All right, so we're going to go ahead and get started. It doesn't look like anyone was able to attend, so this is really just a recorded lecture, but I'll still go over my points. Again, I kind of broke your questions up into the questions about class and questions about kind of the content. There were several requests for a study guide for the test. I probably will not make a separate study guide, but if you looked over the comments, some of your peers made really great suggestions about various resources that you already have at your disposal that can serve as a study guide for you. So the PowerPoints are a really great kind of outline of the material. Use them as a study guide. You should be able to kind of look at the points, come up with a definition, come up with an example, and that's a great way to start testing yourself to make sure that you know the material. Somebody else mentioned the learning objectives, which are listed. I think they're both in the PowerPoint and in the test questions. These are, sorry, in the textbook. These are what the textbook authors, but also I am looking for you to get out of the chapter. So again, use that as a study guide. Read them, think about, can you answer the questions? Do you understand that learning objective? Can you think of examples? If you can't, then you need to go back and make sure you can address them. So make sure to use those as a study guide. You essentially have all the tools you need. If I were to give you a study guide, I would probably just take the outlines of the PowerPoint. So you've got that already. Also, the key terms in the textbook. They highlight those terms. They give you definitions. Use that as a resource. If it's highlighted in the textbook, probably something that you need to know and you need to understand. So you've got everything you need to create your own study guide, which is going to be more effective than me giving you a list of terms. If you take the time and the effort to identify those key terms, make a list for yourself, write those definitions for yourself, that's going to be much more useful for your learning than if I just give you a list. So please take advantage of those resources. Great suggestions from some of your classmates. There were some questions about the time for the test. The average time to take the test was 1 hour and 24 minutes. You have 1 hour and 45 minutes. I went through this last semester, and let me tell you, you all have a great situation, because last semester I started out giving people like 1 hour and 5 minutes. So I think you have plenty of time. The expectation is that it'll take about 1 hour, 1 minute per multiple choice question. So you have 40 minutes that you probably spend on the multiple choice, which gives you more than 1 hour to write 3 paragraph long responses to those short essays. That should really be plenty of time. If you're struggling with time, most likely it's because you're not coming into the test prepared. While you may use your notes and your book as a resource, you should not be having to look up every single answer. You need to study before you start the test so that you come prepared and you know most of the answers, and then you can use any additional time to look up responses. There's a question about the final project. So your topic proposal is due in week 9. So we've got a couple more weeks before that happens, but certainly be thinking about it. There's also a video with more information in week 9. So if you want to watch that and review the requirements, please do. The question was about whether your sources and your articles need to be peer reviewed. And yes, all of the sources you use in your presentation will need to be peer-reviewed empirical sources. Now, you can sometimes find those in other places. Sometimes Google Scholar has access to full-text academic articles. The library databases, in particular, the psychology databases through EBSCO, are going to be your best bet. Websites, internet sources are not acceptable for this, this paper. Okay. Or I guess it's not a paper, for your presentation, for your final project. You need to have those academic sources. Okay, so I got a lot of good questions about the content, so I'm going to try to address those. So there was a series of questions about self-esteem and depression that were kind of related, although they kind of covered several chapters. So I thought I'd just talk about them in general. So one was about kind of the definition of self-esteem. So self-esteem is always about your own evaluation of yourself. And when we talk about self-esteem, we're talking about, do you evaluate yourself overall as generally positive or generally negative? There are other related constructs which have to do with self-perception, which have to do with kind of specific types of self-esteem. So how do you feel about your academic competence? How do you feel about your physical appearance? So there are some kind of assessments of this that focus on different specific aspects. But when we talk about self-esteem, it's generally positive or negative, and it's your own self-perception. So sometimes when we start talking about social cognition, we'll talk about how we think other people see us. But when we talk about self-esteem, it's just whether we generally think that we're a good person or a bad person. So that's self-esteem. I'm not sure where the idea that it's your evaluation of other people's perceptions. I think that's a different concept. With self-esteem, it's always about how you see yourself. Now, how you think other people see you could play a role in that, but it's really about your own evaluation. So several people commented on this kind of link between self-esteem and depression. First of all, I want to just kind of emphasize that the relationship between self-esteem and depression is correlational. It's not causal. So we don't know for sure. Does self-esteem cause depression? Does depression cause self-esteem? Is there something else altogether, like a major life stressor or a school transition, that could cause them both? We know they generally change together, but we're not sure what causes what. There were some questions about antidepressants. And antidepressants, I think somebody commented that they're not just kind of a cure-all. They're used to treat specific symptoms. They wouldn't be prescribed for someone who just had low self-esteem, right? Low self-esteem is not in and of itself a disorder. And they don't treat self-esteem. They can treat the chemical imbalance that can cause depression. And normally we kind of think of depression as a combination of some kind of chemical imbalance, but also problematic cognitions play a really big role in depression. So things like learned helplessness. And when your book talked about depression and self-esteem, they actually talked about the fact that it's not that people who are depressed have worse self-esteem, or sorry, people who are depressed have lower self-esteem, but it's not that they see themselves as terrible. It's just that they have more realistic self-appraisal, and people who aren't depressed generally have this kind of a rosy picture of themselves, and they see themselves as unrealistically positive. So anyways, most of the effective treatments for depression are some kind of combination of treating with medication that addresses the chemical imbalance, but also using therapy to address those cognitions. And often if we can kind of address the chemical imbalance temporarily, we can make changes to those cognitions, and that can kind of prevent depression in the future. So there were kind of several comments about this, but the point is that you kind of have to change those cognition, the cognition component of depression, change that negative thinking, change that helpless thinking, and that can lead to long-term changes. But sometimes you need that kind of bump of antidepressants to make people kind of available or able to change their thinking. There are also questions about depression and emotion. So one of the questions was about how the chapter says that emotion is a response to an event, and depression seems like a response to maybe something that's not necessarily specifically happening in the moment. And I don't think your textbook really talked about this, but a lot of psychological disorders are essentially problems with emotions, either too much emotion, too little emotion, inappropriate emotion. And so there are many disorders that may be a result of emotions that are kind of not appropriate or not typical. So depression is sadness or apathy, and it's often not in response to something specific. If we think about things like generalized anxiety disorder, this is fear that is not in response to a specific stimulus, just generalized fear that something bad is going to happen. So basically, healthy emotion should and typically does happen in response to an event, but sometimes disordered emotion does not. And I always like this figure. I think it does a nice job kind of showing how depression feels, right? Most people think depression feels like sadness, but some of the other emotions that actually go into depression: hopelessness, self-loathing, anxiety, some sadness, guilt, and then a lack of emotion too is a big part of depression. So the emotional equivalent of watching paint dry, right? So it's not just kind of disordered feelings of emotion or too much of the emotion of sadness. It can also be lack of emotion that can indicate disorders. Okay, so there was a question about the questions at the end of the sections in chapter 6 on page 194. And so the question was, which theory predicts that emotion is primarily determined by how an event in the environment is interpreted? And I can't remember who posted this question, but I think you're right that the book may have listed the wrong answer. And so appraisal theory basically says that emotion is based on how you interpret an event in the environment. The event happens, you have an interpretation, and that influences kind of your physiological and emotional arousal. James Lange theory says that emotion is based on how you interpret your reactions. So an event happens that causes arousal. It makes your heart race or makes tears, and that arousal is associated with an emotion, and you interpret kind of your reaction, you interpret your emotion based on that physiological arousal. So I think the book says that the right answer is James Lange, and I agree with you that I think appraisal makes more sense for the response to this. So that won't be on the test, but it was worth noting. Okay, somebody else brought up the issue of guilt versus shame. And so kind of the big distinction that your book makes is guilt is seen as specific to an action. So I did something bad that I feel bad about, a specific thing. Shame is more generalized. I'm a bad person, right? I'm ashamed of myself. I'm not ashamed of generally a specific action. I just have this feeling that I'm not worthy. I'm not a good person. So guilt, if it builds up, could definitely lead to shame, right? If you feel like you are constantly doing bad things and constantly hurting people, it could lead to shame, could contribute to depression, because depression often is associated with feelings of guilt as well. But having engaged in a bad act suggests a few potential ways to fix it, right? So if you did one bad thing, you can apologize, you can do some kind of remediation act, something else. So that's fixable generally. Being a bad person, in contrast, is much harder to fix. And so that's kind of the big distinction between guilt versus shame. Okay, somebody else asked about the dark tetrad, which is the personality traits of narcissism, psychopathy, Machiavellianism, and sadism. And so people with these personality traits are interesting because they generally are more inclined to hurt other people, but they actually are high on emotional intelligence. They kind of use their emotional intelligence to hurt people. And so somebody said something to the effect of, I think they had thought that these people didn't feel guilt. And there is some evidence that they feel less of some emotions like guilt. But I think the bigger thing that's happening is they have this emotional intelligence. They understand how other people will react, but they actually have different, so they feel those emotions sometimes, but they feel those emotions in response to different stimuli. Okay, so this figure is the figure that I often show in my development class, but I think it's relevant here. So it's looking at adrenaline, so not a specific emotion, but of course we know that that physiological arousal caused by adrenaline can affect our emotions, right? That's consistent with that James Lange theory. And so they looked at how people respond to a non-stressful situation. To watching a non-stressful situation versus watching a stressful situation. And they compared the amount of adrenaline that people who have criminal convictions have versus people who have no criminal convictions. And so presumably the people with criminal convictions are more likely to have psychopathy and potentially some of these other dark tetrad traits. And so what you can see is the people who have no criminal conviction show much higher arousal in response to a non-stressful situation as well as a stressful situation. The people with the criminal convictions, so presumably those who are higher on psychopathy, show less arousal to both stressful and non-stressful situations, and they have less of a jump. It's kind of hard to see in this. But there's evidence that, for example, boys who later committed a crime have lower levels of arousal and are less bothered by the pain of other people. So they understand that other people might be upset by it, thus they have the emotional intelligence, but they personally do not experience as much upset about it. Somebody used the example of Dahmer. I only got through the first episode, so I am by no means an expert, but I think that it demonstrates that he knows how to make other people feel safe or tell people what they want to hear, but he doesn't necessarily have that same reaction. So you can have emotional intelligence maybe without necessarily feeling all those emotions or without having those emotions in response to the same stimuli. You might know what triggers another person or comforts another person, even if it's not the same for you. Okay, a couple questions about social cognition, I think was kind of the last category of questions. And again, we got more questions about kind of disorders, personality disorders. So somebody asked about how the fundamental attribution error works in someone with a personality disorder, and especially with antisocial personality disorder. I thought this was a really interesting question because it kind of gets at the root of, like the root of the question is really about, are there individual differences in how much we experience the fundamental attribution error, right? So again, the fundamental attribution error is we tend to assume that other people's behaviors are due to their personality while we explain our own behaviors in terms of the situation. And so the question is really, okay, is there variability in how much people do that? Are some people more inclined to make situational attributions and other people more inclined to make dispositional attributions? So I was trying to look and see if I could find anything about this. And I actually couldn't find a whole lot of research on this. So I don't think there's a whole lot being done, but I think it's a really interesting question. There is evidence, there's cross-cultural evidence that does show that people in individualistic cultures tend to make the fundamental attribution error more than people in collectivist cultures. So we might assume that someone who has their own individual intentions in mind, so somebody with, for example, antisocial personality disorder who manipulates other people to get what they want, might be particularly likely to make this kind of error. So they might be more likely to say things like, the victim deserves what they get because they were part of a certain group or in a certain place. So they may be more inclined to make this error. So I thought that was an interesting question. And lastly, somebody asked about the cognitive miser. So the cognitive miser is a component of the mind, basically, that leads us to try to avoid extra thinking. And so it's about, we tend to describe it as being more about actively avoiding thinking too hard. We're trying to conserve our effort, but it also happens automatically. So we often think about kind of attention as a limited resource. So when you're already exhausted, you'll do everything you can to avoid exerting more mental energy. So we use things like heuristics, those mental shortcuts that happen automatically. And another thing, and I think the person who asked this question was kind of leading to this, is burnout, right? So burnout can limit our motivation and our attention and our effort, how much effort we can put into things. And so I think that ties in with the cognitive miser, but normally we talk about the cognitive miser, we're talking about kind of conscious efforts to limit how much thinking we do, where there are a lot of other things like being exhausted at the end of the day, which might lead to us minimalizing our thinking without that conscious effort. Okay. So we had a few people who came in throughout. Are there any questions before I stop the recording? All right. Well, thank you all, and please let me know if you have more questions.